Good morning, everyone. It's fine Sunday morning. It's cloudy here in New Jersey. Um, the latest coronavirus statistics for the U.S. shows that we have over 123,000 cases now. Um, you know, again, we're have the most in the world, and I imagine that's going to continue for a while. Um, but uh, you know, um, see what's the latest coronavirus news. You know, President Trump had at least indicated that he was considering a quarantine of New York and parts of New Jersey and Connecticut, but that he um, guess he has decided not to do that. But the Centers for Disease Control has issued a travel advisory for New York, New Jersey, and Connecticut instead. Um, and if you travel to states outside of this tri-state area, that they are asking New Yorkers to quarantine. Some states it's voluntary. Connecticut is saying somebody comes from New York, they want them to self quarantine. It's voluntary. Rhode Island's taking it a step further. And if somebody from New York travels there, they will likely be stopped by the National Guard to get their contact information to assure that they are abiding by the mandatory quarantine. So, again, this is not something I've ever encountered before. Um, my years of doing medicine or living, for that matter. So it's pretty interesting that this is going on. Um, I'm very happy to hear that there was no mandatory quarantine because obviously that raised a whole host of questions about how they were going to enforce that and what happens if you didn't abide by that. But um, I believe that taking those factors into account, the administration decided to just issue a travel advisory. Um, you know, we are all Americans and we're all in this together, and I think we should be taking into account others. I think most people would be best to shelter in place. Feel like you can't do that, then if you're going to another state, I certainly agree with you should take as much food and things as you need so you can quarantine yourself for 2 weeks so as to minimize the risk of spread. Want to minimize the risk of spread obviously as much as possible so that we can get this under control. Excuse me. Um, so, I guess I just wanted to talk just a little bit about diet. Good morning, Jenna. Um, it's a little bit about diet. I was reading a little bit, just thinking about that. We're mostly recommending a keto type diet. Took my glasses off and getting a reflection off of the light over here, so I decided to get those off. Um, Mostly recommending a keto, well, just a balanced diet. Um, but as I was reading this morning, was thinking that, again, I mean, these are just general dietary guidelines, but um, by keeping your refined sugars and carbohydrates down. Good morning, Howard. By keeping your refined sugars and carbohydrates down, it gives your immune system a chance to work better. Um, the refined sugars and carbohydrates really are, yeah, they don't help anything work better. Um, that's not to say you can't have that occasional treat, but I would, try to keep your carbs down, your sugars down. I know there's a lot of comfort food going on, um, and but we should try to limit that. Again, adhering to those, high phytonutrient, um, low carb, low sugar, good proteins, organic as much as possible. That's in terms of diet, though, that's the type of diet that will make your immune system as functional as possible. Um, Anybody have any questions or anything about the coronavirus? I was saying earlier that, uh, didn't, you know, I was referencing President Trump uh, saying that he was going to quarantine New York, New Jersey, and Connecticut, but has decided that that's not the way to go. But the CDC issued a travel advisory for people coming to those states. And if you um, are traveling to other states to quarantine, self quarantine for 14 days. Um, with Rhode Island getting to the point of um, that they're going to have the National Guard stopping cars with New York license plates, taking their contact information to assure that they are abiding by those rules. Good morning, Krista. Um, so Chris had mentioned I was talking to people about diet a little bit this morning, about trying to avoid those refined sugars and carbohydrates. And even though those are great comfort foods, certainly keep those down in the diet because too much of those can actually impair the immune system. So, yeah, I don't know. Anybody have any thoughts on anything they want to discuss? I think starting in a few days as I do this, I'm going to start doing some, we're going to be talking about coronavirus while this is going on, but I believe I'm also going to start talking about bringing some functional medicine topics in. Um, have this idea that we can, get some education going on general functional medicine and what functional medicine, integrative medicine doctors do and why you should seek one out. So be more on that as we go along. Good morning, Dana. Good morning, Betsy. Uh, Dana has a question. Is it true in regards to only take Tylenol if you have symptoms? Well, Dana, so what Dana is referencing is that there are reports that if you take aspirin or um, Aleve or Advil, that it can lead to complications. Certainly, it's been seen in some age groups with the flu, and I think they are just, out of an abundance of caution, recommending that people, you know, avoid those. Um, and to stick with Tylenol. That's the best available evidence that we have right now. I don't think there's strong evidence that how it affects the coronavirus yet, but um, we don't want to, find out. Certainly for certain age groups, the younger children, that kind of thing, they are definitely told to avoid um, that if they have the flu. Um, for the other age groups, some people are taking those chronically for their inflammatory arthritis and that kind of thing, and it's unclear right now what um, the risk is to taking the NSAIDs, the non-steroidal anti-inflammatory drugs, including aspirin. But um, Tylenol would certainly be my first line of defense. Um, so thank you for that question, and thank you for everyone that's on. Um, any other questions um, about coronavirus or anything else? Any functional medicine questions, integrative medicine questions? Yeah, I guess I should also, I've been thinking about the our microbiome and its relation to health and immunity and that kind of thing. So we want to make sure we keep that healthy. So, general dietary guidelines, but also we should make sure we're getting some fermented foods into our diet to help us with our microbiome. Um, you know, I am a believer in probiotics, getting probiotics into our diet um, would be is a good idea. Um, so I believe that helping our microbiome, helping our immune system there is um, will help us either keep us immune, hopefully, to COVID-19, or help us if we get happen to contract it, will lessen our complications. Morning, Tatiana. Um, so yeah, keeping a healthy microbiome, and the general dietary recommendations that I had mentioned earlier. Um, Having a low carb, low sugar diet, tending towards keto. We're not looking for strong keto here. Helps your immune system work better. Um, it's not recommended to do any prolonged fasting during this time because though it boosts your immune system later, that can um, impair your immune system in the long run. And so prolonged fast, I'm talking more than 36 hours. The the intermittent fasting, where you're fasting about 12 to 16 hours per day, is there's been no evidence that that impairs the immune system. So I would recommend, if people are doing that, um, to continue that. And that has a whole host of benefits in helping to control weight and helping people to reverse fatty liver. Um, to decrease insulin resistance, improve insulin sensitivity. So I am a big proponent of intermittent fasting. So um, yeah. Any questions on that? Any questions on diet? And if you haven't done so already, I would recommend Jenna's immune support and more group that you can find. Go to check our Princeton Integrative Health page, and I believe you can get to it from over there, or you can just search for the immune support and more group. So okay. All right. If there aren't any other questions, I am going to sign out. I'll be back on 8 o'clock tomorrow morning. And people have questions, let me know. And take care of it then. Dana, you're welcome. Thank you so much for everybody for stopping by. Again, going to be on, um, let's see, I think the new schedule is going to be, I'm going to do Monday through Thursday at 8 o'clock. Friday, I see patients starting at 8 o'clock. So probably Friday, I will not um, be doing one. And then Saturday and Sunday be 9 o'clock. If anybody thinks I should do it later than that on the weekends, let me know. You can always move it a little later. Um, but otherwise, okay. No other questions. I am going to say goodbye for now, and I'll see anybody who's here tomorrow morning. Okay. Take care. Have a great Sunday, and stay safe and be healthy.